Welcome everyone. So now we are going to discuss another topic of neonatology, and that is infant of diabetic mother. Now, as the word indicates, infant of diabetic mother means those babies who are born to mother having diabetes. Now, the definition of this is an infant of diabetic mother is a baby who is born to a mother with diabetes or mother having diabetes, whose blood sugar glucose level is high throughout the pregnancy. Now, blood sugar of mother is high, blood glucose is high. So, what problems a baby can develop because of this increased glucose level? Now, clinical features are large. Baby will be large and plump. Baby macrosmia will be there. Baby will be large in size. It's estimated 4 kilogram will be the weight of the baby. So large baby with plump baby, macrosmia, that condition is known as macrosmia. Uh, Puffy plethora face will be there, round moon face, but the face of baby will be round like moon, and baby will be reddish in appearance, and fetal hyperglycemia will be there, and fetal hyperinsulinemia due to maternal hyperglycemia occurs. Now, what happens when mother blood contain increase amount of the glucose? That blood when goes into the fetal circulation, that will trigger increased release of insulin. So fetal will present with hyperinsulinemia, means increase insulin in the blood of baby. So that will be known as fetal hyperinsulinemia. Now, the complication for infant of diabetic mother is fetus may die because of uh, fetus may die in the last trimester of pregnancy. Macrosmia means large size of the baby causing birth trauma. At the time of birth, baby may get trauma because of excessive size. There may be laceration or other trauma can be happen like intracranial hemorrhage and other, and asphyxia will be there. Baby will be asphyxiated because of increase in the size. There will be obstruction, and baby may be develop asphyxia, increased possibility of C-section. So this increased size of baby may cause risk of C-section in the delivery of the baby. Now, neonatal respiratory distress can also be there in infant of diabetic mother with metabolic problems such as hypoglycemia. Baby may develop hypoglycemia or hypocalcemia. So hypoglycemia and hypocalcemia can create a lot of problems for the baby as well. Now, hematological problems like polycythemia, as we discussed, the baby will appear reddish with a puffiness. So polycythemia occurs, and hyperbilirubinemia, baby will develop jaundice as well. High risk of congenital anomalies, most commonly like cardiovascular defects, can be there in the baby. So these are complications of baby of macrosmia with the infant of diabetic mother. So how can we manage this condition? How can we treat the baby whose mother is having diabetes? So the management for this baby is infant should be screened for malformation or injury, because at the time of birth baby is having excessive large size. So because of that large size, baby can develop a lot of trauma during birth or during C-section. So we have to assess for the screening for the malformation and injuries of the baby. And the second is frequent breastfeeding should be encouraged by the mother, and the neonate should be monitored for blood glucose, because baby is more prone to develop hypoglycemia because of excessive insulin in the blood of baby. So blood glucose is maintained for first 3 days of the life. The other morbidities such as respiratory distress syndrome, hyperbilirubinemia should be appropriately treated. So in this way, a baby having diabetic mother can be treated by these methods. So now let's review this topic. The infant of diabetic mother is, as the word indicates, means mother is having diabetes, so baby may develop hyperinsulinism, and that hyperinsulinism can create the condition hypoglycemia in the baby, and birth trauma, birth asphyxia, and these are the clinical features. Baby will be large in size, and a reddish moon shape of face of the baby will be there. And complication like birth trauma, C-section, and injuries can be there, and managed by management by assessment of the baby for hypoglycemia, hypocalcemia, and injuries should be assessed properly. So in this way we can treat the baby of diabetic mother. So this was topic. In next video we will discuss another topic of neonatology.